Meditrack is a revolutionary digital platform that transforms traditional paper forms into interactive, multimedia content. This innovative approach enhances the shared consent process, making it more engaging and effective. With Meditrack, every patient interaction is documented, creating a comprehensive forensic audit trail. This not only improves patient understanding, but also significantly bolsters a clinician's defense in legal cases. Embrace the future of informed consent with Meditrack, where patient engagement meets legal protection. Today, we will explore 4 key areas. First, the 60-second patient onboarding process designed to streamline the initial experience. Second, the digital consent form, which simplifies the paperwork and enhances patient understanding. Third, the patient review system, allowing for any questions from the patient regarding their consent. Finally, the status dashboard, providing real-time updates and insights on each patient's consent status. Using the Meditrack Secure Card, the clinician taps their smartphone to open the secure onboarding form. This initiates the 60-second patient onboarding process. The clinician collects verbal consent along with the patient's name, email, and phone number. The patient then receives a code via SMS. They provide this number to the clinician, confirming their number and consent. The patient is now successfully added to the system. They receive the consent form and can complete it in the comfort of their own home.
Please pay close attention. At the end of this narration, you will be asked to confirm your understanding of the procedure, the associated risks, and the alternatives available to you. The extraction of wisdom teeth, also known as third molars, is a surgical procedure. The surgeon will begin by administering a local anesthetic to numb the area. In certain cases, sedation or general anesthesia may be utilized to enhance your comfort during the procedure. Once numb, the surgeon will make an incision in the gum tissue to expose the tooth and bone. Any bone blocking access to the tooth root will be removed. To ease the extraction, the tooth may be divided into sections before removal. Finally, the site is cleaned, and sutures may be placed to promote healing. A gauze pack will be applied to control bleeding and assist in forming a blood clot. While your dentist or surgeon may have recommended extraction, there are alternatives to consider. One option is clinical observation, where you leave the teeth in place and monitor them with regular x-rays and exams. However, this approach carries risks such as future infection, decay of nearby teeth, or even the development of cysts and tumours. Another alternative is partial extraction, also known as coronectomy. In situations where tooth roots are close to a major nerve, the surgeon may choose to remove only the crown of the tooth, leaving the roots intact to reduce the risk of nerve damage. As with any surgery, there are inherent risks. While complications are statistically infrequent, it's important to be aware of the following potential risks and side effects. Common side effects include post-operative pain, swelling, and bruising. You may also experience trismus, which is a temporary stiffness of the jaw. One significant risk is dry socket, also known as alveolar osteitis. This occurs if the blood clot is lost from the extraction site prematurely, exposing the bone and causing significant pain. Infection is another possibility, which may require antibiotics or additional drainage. There is also a risk of nerve injury, which can affect sensation in your lower lip, chin, and tongue, resulting in numbness, tingling, or an altered sense of taste. While this is usually temporary, it can be permanent in rare cases. For those undergoing upper wisdom teeth extraction, there's a risk of creating a communication between the mouth and the sinus cavity, which may require further specialized treatment. Lastly, in extremely rare instances, the pressure needed for extraction can cause a fracture of the jaw or damage to adjacent teeth and fillings. By signing this consent form, you confirm that you understand the nature of the procedure, its intended benefits, and the potential complications involved. You acknowledge that no guarantees can be made about the outcome of the surgery. If you have any questions about these risks or the recovery process, please discuss them with your surgeon before signing this consent form. If you are ready to proceed and consent to the treatment as outlined. Please complete by reading and signing the sections below.
After watching the entire non-skippable video, please enter the code displayed at the end of the video to proceed with filling out the form. You can view any of the frequently asked questions, and you are required to check any of the listed medical history or risk factors that are relevant to you. And lastly, please read and review the text sections and click Submit to submit your informed consent form for review by your clinician prior to your procedure. After the patient completes their informed consent form before the procedure day, a PDF of the signed consent form is emailed to the clinician. This allows the clinician to review it with the patient on the day of the procedure. If the consent form is not completed or is overlooked by the patient before the day of the procedure, the system will notify the medical practice. They can then contact the patient directly to ensure all necessary paperwork is in order. Any highlighted information provided by the patient on the submitted consent form will be included in the clinician's PDF email. This information can be clarified and discussed before the procedure takes place. Once this final stage is completed by the patient and the clinician, the outcome is more beneficial to all parties involved, with a more informed patient and a better protected clinician. Our consent dashboard provides a real-time, time-stamped overview of the process. It displays the current status of all onboarded patients. You can see who has not opened the consent SMS, who has completed the consent questionnaire, and who has watched the consent video. Additionally, it highlights those who have finalized their submission with the clinician. Stay informed and streamline your workflow with our comprehensive dashboard. All information, including signatures, health history, medical conditions, and the signed finalized consent consultation statement, is stored for easy retrieval if needed in the future. Welcome to our streamlined patient onboarding process. First, you onboard the patient in just 60 seconds. Next, a few days later, they receive their consent form via SMS, allowing them to complete it at their own leisure. Once they submit their consent form, an email containing a PDF of their submission is sent to the clinician. This submission is reviewed on the day of the procedure and signed off. Finally, all timestamps and consent statuses for onboarded patients are easily accessible on your dashboard. MediTrack shared consent, ensuring every patient feels seen, heard, and valued. Contact us today and help us build your security and peace of mind.